Hey Strong Siders, today I wanted to start a conversation about elbow pain. If you have elbow pain, please get checked out before trying any of the exercises demonstrated in this video. Today we're going to talk about inside or medial elbow pain. In the video you can see that I've drawn on my arm. That was lots of fun. First things that we're looking at there, where I'm pointing with my finger, is the medial epicondyle. That's on the bottom inside part of my humerus bone, which is my upper arm. The red are my wrist flexors. Those are deep to my finger flexors, which would show over top of those and have not been drawn. This green line that I'm pointing at now is my pronator teres. What it does is it rotates my palm down. This muscle can get short and tight if we're spending too much time as a desk-bound employee. That means your hand's constantly pronated on a keyboard. You're working your finger flexors, wrist flexors, and pronator teres, really mashing up that whole corner of your elbow with tension. The problem is that we don't spend enough time in supination in our daily lives. Outside of work, we can aggravate this area through sport. This is also called golfer's elbows because the way the wrist rotates over as you make your swing. Also, climbers get very aggravated in this area from flexing the whole time with the palm pronated towards the wall. One way to help restore function is to do eccentric loaded rotations with a hammer. So you want to start up high close to the bell of the hammer where the weight is, so that you have a shorter lever. You don't want to be way down at the end creating tons of force here. What I'm going to do is I'm going to allow the weight to slowly supinate out to the side, and then I'm going to use my opposite hand to pull it back in. You're going to want to do this multiple times throughout a day, maybe just doing 2 sets of 10 to start. The idea is that you want to do it throughout the day so that you start to remodel the function of this muscle. If you only do it once, maybe every couple of days, you might not change the function. As you get stronger, you can slide your hand lower down on the handle, which will create a longer lever, and that'll add more resistance. If your pain is acute and it just started happening, try to give this some rest or some really light just hand movements before you actually add the weight in. With acute injuries, you do not want to increase the inflammation, so take it easy at first. If the pain is chronic and has been around for a really long time, you're going to have to accept a little bit of discomfort. The idea though is the pain that you currently have shouldn't be more after you're done. It should either be the same or less. If you have more pain in the hours that follow, you're probably doing yourself some disservice. You might still get better, but you'll get better faster if you don't increase your pain. Once you don't hurt anymore, or if you don't currently hurt but you're worried that this might be a symptom that might start happening to you, you can do some preventative maintenance by doing the same exercises. If you currently don't have pain, you can feel free to do the concentric portion of this movement where you pull it back up with the pronation of the wrist as well, just going back and forth between supination and pronation with the wrist. It's also important to understand the difference between supination pronation of the wrist and internal external rotation of the shoulder. So while you're doing these exercises, be sure to try to keep the soft part of your elbow pointing up while you're rotating your wrist. Watch your bicep, it should not move. Okay, Strong Siders, that's it for today. Hope you had a good one. And remember, this is just the start of the conversation. If you're having this pain, please seek out a healthcare professional to help figure out exactly what it is before you get started on your rehab.